Assalamualaikum. A very good afternoon to everyone. So my name is Muhammad Khairul Hashmi bin Firdaus. Today I'll be presenting my part and parcel of my research PhD project, which is known as developing a mHealth intervention for diabetic patient in community setting. Okay, the mHealth project that I named as Diabetic Care Self-Management Mobile Health Application. So this is the outlines for today's presentations. As we are aware that diabetes mellitus is one of the greatest concerns among non-communicable disease around the globe. So the prevalence is keep rising as per noted in the Diabetes Atlas edition 2015 as published published by the International Diabetes Federation. In fact, World Health Organization 2060 also mentioned that the prevalence of diabetes mellitus among low and middle income country is in increasing trend. In Malaysia, from the national database, National Health Mobility Survey shows that the trend of the diabetes mellitus also increasing as per reported by the FASO 2013. So, of course, diabetes mellitus um, will be known as uncontrolled if it's reading HbA1c reading more than 6.5%. Uh, it okay if the uncontrolled of diabetes mellitus, it will lead to many complications such as microvascular and microvascular. Okay, one of the commonest microvascular complications is known as diabetic foot complication apart from um, retinopathy, neuropathy, and nephropathy. Okay, even though the patient is aware that the food complication is important component for diabetic patient, but they are still have poor adherence of food care. So why this is happen? From the literature review, it found that 6 factors that may contribute towards poor adhering of food care. The first one is lack of knowledge. We need to say the patient have very limited knowledge on the food care that they didn't perform the food care. Number two is poor communication between patient and healthcare provider, meaning to say that when they have poor communication, the teaching and learning activity are related to the food care activity might not might distorted. Okay, the third one is self-perception little need to perform food care. Meaning to say they think that they are okay, so there is no wound on their feet. So current in the present condition, they are okay, they are good. So they think no need for them to perform food care. Number four is disregard food care recommendation. There are few factors that may contribute toward this attitude. Perhaps they may also uh, their condition, like maybe they working condition, so they might not have time to perform the food care recommendation, or they might also have a quite a hectic schedule, working from nine morning to night. Number four, lack of visible symptoms and gradual onset of diabetic foot ulcer, meaning to say that since it is not presented at their food, so they might say that uh, the it is not really important for them to taking care of their food because they eat the food still seems still okay. And lastly, physical health and cognitive limitation, which may cause that the individual to perform on their food care by their own. Okay. Literature review was conducted to identify um, a gap in current existing diabetic food care program. So I use the PICO analysis framework, which is to identify the problem. To analyze the existing program for the um in order to develop a new program. So from the analysis, it shows that technology-friendly program would be helpful in managing diabetic food care, which the current existing mobile health program are mostly focused on general diabetic care rather than on food care. In addition, the mobile health application shows a promising strategy in promoting health behavior. Combined with the concept of mHealth, mobile health, together with the self-management, um, I developed this program and to um, so why I choose self-management? Because self-management as a promising approach for primary setting in managing their own condition as per mentioned by Grady and Goff 2014 and Harris and Wallace 2012, meaning to say that patient become have self-responsibility on their own condition. So, hence, in this study, a mHealth intervention was developed known as diabetic care self-management mobile health application. Okay, the aim of the initial study is to describe and validate the mHealth intervention that has been developed. So, I employed two methods. For the method, I employed two phases. First one is development of the mHealth tool, which is I am using intervention mapping framework by Fernandez et al. 2019 in developing this mHealth program. Number two is I'm using the test e-health tool assessment guidance by Kasem Adams et al. 2015 in observing the validity of the mobile app and to for the experts to rate the content validity and the validity of the intervention too. A tryout study also was conducted to see the feasibility of the app to be introduced to the patient during the actual data collection. So there are 6 steps in IM framework, which is identifying intervention focus area by understanding the health problem, population at risk, behavioral, environmental causes, and the determinants of behavioral and environmental condition together with available resources. I will explain in details later on, but I will just give a brief idea what are the IM framework is. Okay. Step number two in the IM framework, describe the behavioral and environmental outcomes, create objective for the changes in the determinant of behavior and environmental causes, and specify the target of the intervention program. Number three, identify theory and evidence-based behavior change method that influence the determinant and translate this to practical application that fit the intervention context. Number four, combine the intervention component into a coherent program that uses delivery channel that fit the context. Number five, develop implementation strategies to facilitate adoption, implementation, and maintenance of the program. And the last one is plan both process and outcome evaluation to assess program implementation and efficacy or effectiveness. As we are aware, as I mentioned earlier, so the focus intervention, the focus area that in this study is on the diabetic food care. Of course, in diabetic mellitus, it involves a holistic approach. Therefore, controlling diet is also important in order to control the blood sugar and uh, so that uh, we can control blood sugar and to um, how to say to promote the food care behavior. Okay, then by identifying the factors that may impede towards the self-adherence toward the food care. Therefore, this app was developed according to this factor, meaning to say that considering the they might considering the patient might need what we call as input. So uh, a tool that use the very simple language, easy to understand, and has been created and accessible by the elderly also. Okay, the theory that I use in the developing of the study is the individual and self-management theory. This theory this theory is focusing on the self-management, meaning to say that it not focusing only on the individual but also the family member as part and parcel that trigger the individual to perform behavioral self-management and behavioral modification. Okay. Okay, this is the diabetic care self-management mobile health application that I developed. Okay, the first one, when the patient enter into click on this icon, they will a window appear here. In between these two, a window will appear that required for the patient to enter their phone numbers and the password. This is important so that when they when I want to record to see their food care record later on, so I know this I can know that this number referring for this data referring to this number. So so I can justify which number which data referring to which patient. Okay, and then and after that they will lead to into the main menu. In this main menu there are six main menu: food care activity, food care exercise, food care plate, food care record, food care tips, and food calorie tips. Each of these window will lead to many different window. For instance, when the patient click on here, it will lead to this window, and in this window, there are four different icon again. Food washing feet icon, trim nails icon, food inspection icon, and also uh, lotion apply lotion icon. So when the patient click here, it will direct to the video. So mean to say the patient can look from the video for the each activity of the food care. Okay, and then in the main edit for this icon, the patient will list this icon will lead to five different food care exercise. So there are five different here. When the patient click on each of the link, so it will lead to the five different uh, videos, food care videos. Okay, similarly for this one, when the patient click on this icon, it will lead to this food care plate. Meaning to say that a diabetic food care plate, meaning to for the basic recommendation for the patient. So the patient need to have one quarter of carbohydrate, one quarter of food, protein, and half plate of vegetables and fruits. Okay, there are some fruits that they cannot take consume in high in many in high number. For instance, mangoes, rambutan, and durian, because it's high caloric food. So it is not advisable for the patient to eat more than uh, recommended amount. Okay. Then here the food what we call as the food care record. So here is it connected to cloud database, meaning to say that when the patient do perform the food care activity, there are food care activity listed out in the table here. So the patient needs to jot down, not just to enter a number here. For instance, wash feet. For instance, if the patient perform 2 times today, so he or she just need to put the number two here. So it will reflect in my cloud database, meaning to say that I can access to this data from my uh, at my site, at my setting. Okay. And then here is the food care tips. Food care tips here, there are few tips, about 15 tips for the patient to see. For instance, when to buy the food, shoes, when is the best possible time. Okay. And then there are few other tips here. And then here is for the food calorie tip. It's just a basic calorie numbers given, guidance given to the patient. For instance, if white rice, how much calorie for white rice, how much calorie for noodles, how much calorie for green apple, how much calorie for a fish, a fish. Okay. So after okay, sorry for this one, all the information were extracted from the what we call as clinical practice guideline available in Malaysia. Okay, for instance, clinical practice guideline for diabetes mellitus, clinical practice guideline for diabetes food care management, clinical practice guideline for dietary for diabetes food, for diabetic patient, clinical practice guideline for um, clinical practice guide. Sorry, um, a website of from Ministry of Health in regards to the food care activities. Okay, and then after the developing of uh, the apps, then come to the testing for the validity. So I employed for the guideline from KSM Adam et al. 2015 that specifically assess for e-health tool. There are three important criteria in assessing the validity, like relevance, likely effectiveness, and appropriateness. In relevance criteria, it measures the relevancy of IFSMT, the Individual and Family Self-Management Theory, IFSMT with Diabetic Care Self-Management Mobile Health Application. While in the likely effectiveness criteria, it measures the effectiveness of diabetic care, the apps, components that design and the likelihood of the apps influence the behavior modification of the intended intervention target. For instance, when you give the video for the food care activity, you intend for them, your intention is to for the patient uh to have the idea how to perform food care activity. Okay. Appropriateness meaning to say appropriateness of the diabetic care management mobile health application for Malaysian population use according to the language use, nature of the activity, comprehensible instruction provided and culturally appropriate. So a Likert scale of 1 to 4 in surveying this content validity. Scoring 3 to 4 will be considered as good for the each expert if the expert score 3 to 4 while to score of 1 to 2 indicates that revisions required. Okay, a group of experts was used in assessing this validity of the app. This this expert were a diabetes nurse educator, a diabetes mellitus, dietitian who are specialized in diabetes mellitus condition, and then medical officer who are in charge of the non-communicable communicable disease at district level. There are 16 sections identified in the assessment of the content validity on the diabetic care self-management mobile health application. A tryout of the app was conducted among 10 diabetes patients after validation assessment. Of course, before the tryout conducted, obtained written consent was sought more so that it is abide by the ethical to meaning to say that we want to have ethical clearance prior to data collection conducted. So ethical clearance was obtained from the Social and Behavioral Science Institutional Review Board, Faculty of Nursing, Songkla, Thailand, and also from the Medical Research Ethics Committee, Ministry of Health, Malaysia. Okay, okay. For the finding and discussion, it shows that the expert agree that all three criterions, relevant, likely effectiveness, and appropriateness, that meaning to say that the expert scored 3 to 4 for each category in the all 16 section. Thus, it show that ICDI score for this item, for this app, uh, and general CBI score is good, which is score of 1.00. This is classified as good to be used as mentioned by Polly et al. 2007 and Yusuf 2019. So means all the experts agree that the mobile application was relevant, appropriate, and more likely to be effective in behavior modification. Okay. After that, a tryout on 10 diabetic patients was conducted. There are two main problems in regards to the app that identified during the tryout. Number one, three out of 10 patients has problem in installation of the app. Meaning, in for the patient to install this app, they will be invited through WhatsApp. It cannot be download from the Play Store because this is not using the what we call Play Store rental service or something. So alternative method was explored on how to invite the patient to download this app. So alternatively, we are using Bluetooth sharing, invitation by email, or also by using a share it application. From out of three, there are only share it application show promising method in sharing this what we call invitation in downloading this app, which has shorter duration and easy to be installed for this diabetic care app. While by using Bluetooth and email, it taking long time, and sometimes it cause the uh, what we call the patient problem in downloading the diabetic care app. Number two, okay, the second problem is regarding to the function of the food care record, which in the food care record, there are columns for the patient to fill in the number, that the frequency that they do for the each activity. However, it just only for 1 week, meaning to say that after 1 week it will be full. So I need to clear it manually through the cloud database. Thus, I need to ensure every week the cloud data will be empty so that the patient can enter a new data. So, what um so every week, so the patient, since the patient has learning contract, meaning to say that we want to revise, we want to see if the learning contract is used was used to help the patient to identify what they want to learn in regards to the care activity and dietary behavior activity, dietary management, so that they can fulfill their learning objective. So when we review the learning contract, so myself also will ensure that the record is clear for the ready for the next following week session. So uh, each data that have been stored in the cloud, it will be remain there, but I will do a uh, sorry, each data will be stored there, will not be touched until the end of the session. So in conclusion, the app show a good validity index, and it shows that it's appropriate to be used as an intervention tool in this study. Even though there was two problem encounter, however, possible solution was explored in addressing the issue. Further studies recommended to see its effectiveness toward a better health behavior modification, specifically for food care and dietary behavior. Okay, this is all my references, my acknowledgement to because this was supported by the Higher Education Research Promotion and the Thailand's Education Hub for Southern Region of Asian Country Project Office of the Education Commission. Thank you very much. Mhm.